Hi everyone, my name is Erica. I am a dental hygienist and worked in Idaho at Terry Riley Health Services for a number of years. And what I mostly did there was lead our medical dental integration efforts. So I was a dental hygienist working for a couple of years in the medical side instead of the dental side, which is why this program is just near and dear to my heart. This is what I believe is the best practices is to have this really close relationship with the medical and dental providers. So I'm super happy to be speaking to you today. I'm gonna set up my slides. Let's see. Can you see that okay? Okay, perfect. So, like I said, when I was working in Terry Riley in the medical dental integration program that we had, I worked closely with especially the pregnant patients and the kids. I would see pregnant women when they came for the multiple pregnancy control appointments and do oral health screenings, so checks dental checks, and a lot of oral health education and care coordination within Terry Riley and outside of Terry Riley to providers like the clinic where Dr. Esplin works, periodontal health specialist when the case needed it. And then with the pediatricians, I worked during all the appointments that little kids had, since little tiny babies that you wouldn't think I needed to be there checking their mouths because they were 1, 2, 3 months, to all the kids that the pediatricians saw. So I think it's a great concept, and I'm just happy to speak of my experience here today and kind of bring practical ideas and tips for when you have conversations with your patients about their oral health in the medical side. So um, let's see if I can advance my slides. Okay, does that work? Okay, so this is the general oral systemic connection across the lifespan, and Dr. Esplin did a great job in our last session explaining all the connections that oral health has with overall health. And it goes from pregnancy, childhood, adolescence, all the way until old age, and it's related, or oral health is related to your overall health in all stages in your life. And it can be very, or it can affect your health tremendously. So today we're going to focus on the beginning part of this set. You can see a whole set of information on all these stages and those links that you're going to get with the slides. So today we're going to understand the bidirectional connection between oral health and pregnancy. A little bit, and like I said, more of an applied base since Dr. Esplin already shared with you all the scientific basis and inflammation basis behind this. Describe the importance of dental care during pregnancy and in early childhood, and I think it's all connected. So I like to kind of make connections throughout, not just during pregnancy and separately for childhood. I think it starts at pregnancy and it goes on. And then just practical recommendations from my experience talking to my patients that might be helpful for you to talk with your patients. So a little bit of a touch on the physiological changes during pregnancy. And I know most of you know this already, but just as a review, due to the hormonal changes during pregnancy, and this carries through breastfeeding and then later on in menopause, and it happens earlier on during puberty, a lot of hormonal changes happen that affect our gingiva or our gums and make them more susceptible to oral infections. A lot of the changes that happen, a lot of the gingivitis, gingival inflammation, periodontitis is because our body kind of overreacts to the plaque that usually we all have. So even in patients with little plaque, like you see in this top picture, even if they have little plaque, many times they have a lot of inflammation. So it's kind of like an overreaction to that inflammation, to the point of the lower picture that you see that it's pyogenic granuloma during pregnancy, so granuloma gravitatum, and that is a complete overreaction of the gingiva to the accumulation of plaque, sometimes foreign body. And so this is important for you as medical providers when you're doing your other assessments of the patient to look for those early signs or over reactions or more severe gingivitis in these patients. When you're doing your ear, nose, and throat, all your checkups, also pay attention to the gingiva. That might be a little more sensitive, more overreactive, bleeding a little bit easier. Also, to bring it to your awareness more often, a lot of the patients during pregnancy, because they have dietary changes, say more snacking, the cravings, things like that, different foods that they feel more comfortable drinking, like for stomach upset, they might drink more Sprite or sodas, things like that. Or due to morning sickness, the vomiting, that could be make them also more susceptible to dental issues, to problems like dental erosion. So there are behavioral and systemic risks there. And also sometimes, even in my own experience, a lot of pregnant women have a hard time brushing their teeth because of that sensitive gagging reflex. So many of them don't. A lot of them are super sensitive in the morning, so they don't brush their teeth in the morning, or can't reach all the way in the back. So a lot of plaque accumulation in the back teeth. So that's one of the things to consider. Kind of ask your patients, are you having a hard time brushing your teeth because of your gag reflex or sensitivity or morning sickness? And I'll give you a few kind of tips and tricks a little bit down my presentation as well. But something to kind of think about. Those things that related to pregnancy and habits also affect the health of the gums and the teeth. So it's really, really important to have that timely dental care and education to support the health of the mom and consequently of the baby as well. Impacts on pregnancy and pregnancy outcomes. Dr. Esplin alluded to this in his presentation. So periodontal disease increases the risk of preterm birth or low birth weight due to systemic inflammation, and pathogens from periodontal disease, from gum disease, travel through blood to the placenta. We found pathogens in placenta that are related to gum disease. So as I bring it up to my pregnant patients, I say, do you know that any dental infections, gum disease, those bacteria can travel and get all the way to your baby and sometimes make it so that you have earlier delivery than normal or than we would want to, or that your baby is a little bit of a lower weight. And most moms don't make, obviously, most people don't make this connection, but also it's really important for them. They're doing the best they can to have a healthy pregnancy, to have a healthy baby. So bringing it to their attention that taking care of your mouth in consequence helps have a healthy pregnancy and a healthy baby, or at least prevent certain complications. Preventive interventions, like Dr. Espling again said, treating this bacterial load, reducing the bacterial load during pregnancy. And as I'll talk more ahead, not only for periodontal treatment, not only for gum health and for pregnancy health, but also to reduce that bacterial load so that we're not transmitting it to our kids when the baby comes. So I always talk about having a healthy mouth before you have your baby. And then education and outcomes. So a lot of education. There is a lot that goes on from my experience as a patient and being there for the pregnancy appointments. And so I understand there's a lot of information you're trying to share with your patients. So maybe bring in one little thing at every appointment in terms of oral health education, like start by, have you seen your dentist? Do you have a dentist? Are you brushing your teeth twice a day? Do you know? Like one little bit tidbit at each appointment helps a lot so that it stays top of mind and help with their health. Um, Again, telling our patients that dental care during pregnancy is safe and also necessary. Routine dental exams, x-rays, radiographs, treatments like cleanings, fillings, all that is safe during pregnancy. Usually safer at all stages, but also patients, providers, everyone is more comfortable during that second trimester. At the beginning, we try to be very cautious, and at the third trimester, the patient is really uncomfortable and probably doesn't want to lie down all the way back in the dental chair. So I always try to motivate my pregnant patients to see the dentist and seek care earlier in their pregnancy. So we have kind of like the whole pregnancy to do all the treatments if necessary and not have to do it all when they are all uncomfortable and don't want to be lying down for a while in the dental chair. And in these, I also try to talk to my pregnant patients about I tell them, I really don't think you want to have a toothache at 2 a.m. in the morning when your baby is finally sleeping. So let's try to get all that dental treatment done while you don't have your baby yet. That way, when you have your baby, you have a few months to just focus on your baby and you're healthy and good to go, not having any dental pain or trying to find dental care for yourself or somebody to care for your baby so that you can have your dental appointments. So, having those conversations early with the patients, ideally, and also, I believe continues to be this way in Idaho. Medicaid for those patients with lower resources covers during pregnancy dental care. So another reason to get the treatment and those assessments done early in the pregnancy so they can get their treatment while they're covered by Medicaid. Um, it's safe to use local anesthetics, antibiotics. Usually, nitrous oxide is not recommended, so laughing gas. But usually, what we try to do is have good communication, and our providers know all these connections and what to avoid during pregnancy. So, always recommend seeing the dentist during pregnancy. And then having that collaboration, having relationships with dentists as a primary care provider, knowing where to send them in your area patients that are comfortable with treating pregnant patients and having that kind of collaborative way to practice is ideal. Okay, then a couple preventive strategies. The regular dental checkups, obviously, like I said, to try to catch those issues early and try to provide preventive care rather than advanced dental treatment. Oral hygiene education for morning sickness. Like I said, a lot of patients have a hard time with the gagging reflex or nausea during pregnancy. So a recommendation I always tell them is to kind of like deep breath and then exhale through the mouth. So go, and as you're exhaling through the mouth, you brush a part of your mouth, brush some of your teeth while you're exhaling. That helps not feel that gagging reflex. I did it myself. I try to help a lot of my pregnant patients did that, and it seems to help. So kind of like exhale while brushing a part of your mouth, then do it again until you can get to all the parts of your mouth. It's a quick little advice you can give them. In terms of morning sickness as well, it's a big misconception or mistake a lot of patients do is I just uh, vomit it and I feel gross and I feel like my teeth are covered in acid and I want to take care of them, so I go brush them. And actually, brushing on top of the acidity of the vomit, it's very abrasive. So it's not recommended to brush right away with your toothbrush and toothpaste right when you have vomited. So it's better to rinse with water. If you can make a solution of water with baking soda, that helps too to bring the acidity down. And then wait a little bit until you brush. I told my patients if you have fluoride mouth rinse, like Act mouthwash or any of the mouthwash with fluoride, that's a good rinsing agent if you want to feel like the minty good taste instead of brushing, and wait and brush a little later. Um, or if you do mouthwash, that's enough at that moment. So always trying to educate on the acidity level of the mouth, which goes also with nutritional counseling. When patients are talking to you about, cravings, if snacking and things like that. Um, I am not one of those hygienists that told my patients not to eat sugary things, not do this, do not do that. I don't find that very helpful. So I try to guide on if you're going to have a sweet snack, have it all at once and not have it all spread out throughout the day. If you're going to drink a soda, drink it at once, then drink water afterwards so that you don't have constant exposure to the sugar and constant acidity in your mouth. And that helps reduce the risk of cavities. So for patients that are snacking, and many patients need to snack a little bit before going to bed when they're pregnant to feel better. Recommend doing something that's not sugary, but also drinking water, always kind of rinsing it out with water and trying to level out that acidity in the mouth or bring down the acidity um, with water. That's very, very helpful. And then again, recommending the dental care before delivery so that they're healthy and can worry about their babies and not themselves when they recently gave birth. Okay, so this moves us on to early childhood caries. Um, and this is so, so prevalent. A lot of early childhood caries. I saw it a lot in our practice, especially in those that don't have access to the dentist or that don't have the educational guidance to prevent it at home. It is even more prevalent than asthma and obesity. And I know primary care providers and pediatricians are looking for this. You know how to recognize it, you know when you see it. Baby bottle syndrome, early childhood caries, and you know to see those black spots in the front or some teeth completely eroded, gone due to caries. But I want you to pay attention to it very, very, very early. There is a lot we can do to remineralize teeth to protect them from progressing. So when you see not even the top picture, it's even a little more advanced. I would love it if you could detect it when you see little white spots, that it's barely weakening, so that we can help with habits and remineralize those spots. So we don't need aggressive, extensive dental treatment, and we can keep the good rapport with the dentist going with the kids. So for this, I always have conversations with the mom, even before having baby, about bacteria transmission, about the bacteria in your mouth is transmitted to your baby. Again, when I was trained back home as a dentist, we try to tell the patients to not like try the baby's food, to not blow on the baby's food, to not kiss your baby. No mom is gonna do that. We're all gonna do all those things and chew a piece of food for our babies. I mean, we need to be realistic with the advice that we give our patients. So I told them the best thing you can do is have a healthy mouth yourself so that you're not transmitting those bacteria to your babies. And so let's try to take care of them and have them understand that the cavity causing bacteria spreads to them as well. So one of the things I try to avoid is cleaning a pacifier or with the mom's mouth. So rinsing it with water is better, but blowing on the kids' food or sharing food is something that probably you want to avoid. Educating them also on the risk factors for decay, especially for baby bottle decay or early childhood caries, um, of not using other drinks that are not milk or water in the baby bottles. I saw a lot of kids come with a bottle with soda, for example, and trying to have those conversations with the parents about not putting sugary drinks. Also reminding them that milk also has sugar, so it would be good for them to, when they are able to, old enough, also drink water after they drink milk is very important. And then it's early intervention. As early as we can have them, the better. As early as we can detect these caries in the pediatrician's office, the better. And that way, the appointments at the dentist are much more better for the kids as well. Uh, that brings me to the importance of age one dental visit. And I think all of you have heard it. You have to see the dentist by age one, but also it's by the time of the first tooth. So my kids, for example, were 13 and 14 months, so they saw the dentist by age one. Well, they saw me since they were newborns, but they visited the dentist at age one. But many kids have teeth at 4, 5, 6 months. The first little tooth comes out. So that's the time they should see the dentist. So age one or the first tooth. And this prevents early childhood caries. This establish a relationship with the dentist very early on. Um, they have done studies where they've seen that they reduces the dental costs later on for the family up to 40% because we're seeing things early. We don't let it progress. And again, this helps create good habits, good fluoride, and they start getting used to the dental chair. It makes it for a great experience for them early on. So H1 or by the first tooth, either or, whichever happens first. I can't reinforce this enough. The earliest we can be in their mouth, checking their mouth. And I taught all the pregnant patients, I saw that before they had the baby, and then when they babies were born, I will go in and see babies at 1 month old, and the pregnant patients were like, "Why are you here? My kid doesn't have teeth yet." But I was showing them how to get in there, how to check and wipe their mouth, and I'll show you with pictures down the road. Um, how to get in their mouth. The earliest we can do those risk assessments, early interventions, like my kids here are, my girl is almost 3 and my son is almost 5, and they were just having fun. We brought the baby, we checked the baby's mouth too, so she brought her baby and was able to check the teeth. They had a good experience, and this goes with them. Um, we moved to Florida and weren't able to have a dentist visit, like an official dentist visit for a while. And when we were going, the first thing she remembers is they had these amazing coloring things at the dental office. I love going and I love the tickling brushing thing they do. So for them it's a good experience. And so they continue to think of the dentist as a good experience. And we also were able to do fluoride varnish early. For example, here in Florida, there is no community water fluoridation anymore. So fluoride varnish becomes really, really important. And dental sealants even more important to prevent tooth decay early. So we don't have extensive treatments later down the road. Nutritional habits with kids, like I said, limiting sugary drinks. And I know you have a lot of conversations with your patients already about progressing from the bottle to the sippy cup to the straw cup, but also talking about what they put in the cup or in the bottle. One of the things that I get a lot is my baby won't go to sleep if it's not with a bottle. And so one of the things I usually recommend was at that point, especially when they're getting older, it's more of a comfort thing. They're using the bottle as comfort. So one of the swaps we can make is try to start getting them that milk, hopefully milk that they're giving them all night, dilute it all the way until it's just water. And warm water usually does the trick because it's a comforting thing. And I tell the moms, it would do either of two things. They will either like it by the time they get to water, they will either like it and have their comfort, but at least it's not sugary, it's not milk, or they won't like it. And so they will stop needing the bottle at night. So um, it's a little bit of a transition, but it can be done. And being patient and being understanding that it's difficult and mom wants the baby to sleep. So we don't want to be like strict and say, just do it. So little by little. And then good home care habits since they are little. So like you see, both my kids there don't have teeth, but for sure they had a toothbrush in their hands early on, just chewing on them, just scratching their gums with it. And I'll show you other little tools like the one my girl has in the top right. That's a banana brush. That's just comforting, but always having them getting used to me checking in their mouth and them cleaning their teeth, scratching their gums, working on home care very, very early. Here are a few tools that you can recommend patients. We all are taught that mom should wipe the baby's mouth after feeding to keep less amounts of that sugary environment in their mouth. That helps create a good oral flora, good bacteria, not those bacteria that are always looking for sugary products. So just there are many products that they sell, like specific little gauze that's for the finger that people could go on Amazon and buy. I just taught my patients a clean rag, one of those like burping cloths with warm water is enough. And just from the very, very beginning, very early when they're very little, just wipe around and try to clean the tongue. One of the hard things is getting kids to be able to brush their tongues. It's weird for them. So since very, very, very little, just wiping the whole mouth with that wet cloth. So for example, my girl will fall asleep when she was nursing. As soon as she'll pass out, I'll try to kind of sneak my finger in there with a cloth. I mean, it is not perfect and it won't be for your patients. And I always gave them grace. Baby fell asleep, but the more you can do it, the better to try to get them cleaned after feeding and get them used to you cleaning. Then when they get a little bit older, we can progress to those little finger toothbrush with silicone, or any of the little silicone brushes that they can use almost as teethers as well, to try to get in the back. And again, try to get the tongue early enough. Try to get the tongue. A lot of these early toothbrushes that you see there that are silicone are also kind of like teething rings, scratchers for when their teeth are coming. And they also, as you can see, have bigger handles so that they cannot push them all the way back in the mouth, so that you could give it to them. You can also use them yourself, but I tell my parents you can give them to them so that they can play with them, get used to them, like them, so you don't have to force your kid later on, like, have an armhole to be able to brush their teeth. The little banana brush was really successful for us. For my son, it was a similar one, but it was a shark brush. And we even clipped it to like if it was a pacifier, but instead it was this thing so that they wouldn't lose it all the time from the table or from the chair to the ground. But they can hold on to them and scratch them. And then I also always tell the parents those freezable chewing teethers are really good. One of the things that I had a lot with parents was my kid won't eat when they're teething, they're struggling, they're in pain. So sometimes giving them a frozen teether before feeding, before eating, helps them, kind of soothes them a little bit, helps with the swelling, the inflammation of the gingiva, and it helps them be a little more comfortable, then they can eat. So that's another one that I always recommend. And then once they're eating and exploring new foods, they have little sacks that you can put like a frozen strawberry or frozen piece of banana, and they can chew on it and have some flavor and have some of the fruit as well. But all those are good. Like, oh, today, hey, have you heard of this little thing that could help your kid? I see them like putting their hands in their mouth and have a lot of saliva. They might be teething. Have you tried this? To me, when the pediatrician says it, it's for they are going to listen. They trust you. When the primary care provider, the medical doctor, shares some information like that, they really trust you, and is really helpful. So at any point where you can help, um, it would be great. Let me check on time. Okay. And then thinking of toothbrushes, one of the quick things I wanted to mention was with toothbrushes, we also want to keep them as small as possible. Many times we give our kids big toothbrushes when they are still too little. Like, for example, the top toothbrush black there that says 10 plus. My son is almost 11, and I would still keep the lower one, the green one, because it's easier for them to reach the back teeth. So I keep it always the smaller toothbrush, always soft, but always the smaller toothbrush. If you have nothing but an adult toothbrush, that will do. But if you can recommend a smaller toothbrush, or if your office, it would be awesome if your office would provide dental toothbrushes, toothpaste, and floss for the kids when they come to the pediatric appointments. Try to make sure that they are age appropriate, that they are as small as possible. I rather err on the side of giving them too small of a toothbrush than too big of a toothbrush, just so that they can get back there a little better. Modeling good hygiene habits early and with happiness around the house. So try to make it a good experience for everyone. Kids do what parents do. So having the mom already doing it, the parents, the grandparents, treating it as a family affair, and then supervising kids brushing. So tell your parents to always help the kids. It's usually until 6 years old, but I continue to do it even if they're older because they miss areas, and it's helpful to check and make sure there is nothing of concern as well. So at the end, a few tips that you can read. You'll get these slides. I don't want to take over too much time. But one thing to always stress to the parents that primary teeth, baby teeth, milk teeth, however they want to call them, are so, so, so important. That's a big misconception. Parents go, it's baby teeth. They're losing them. They're going to get their permanent teeth. But baby teeth hold space for the big permanent teeth. Baby teeth are part of the development of the jaw, so they're important to keep them as long as possible. And then if they get a big infection, they can affect the developing tooth underneath, the permanent tooth. So it's really, really, really important if you have 2 minutes to say to a parent with a small children before they leave your medical appointment is, make sure to take care of the baby teeth. They're super, super important, and they're going to make sure then the permanent teeth that come later are healthy as well. So I think I can talk about this all day, but I'm gonna let us have the discussion about the case and if any of my fellow panelists has any other things. And there are a few references here. If you have something specific you like in terms of maternal child health, in terms of oral health, let me know and I'm happy to share more resources.
Well, thank you, Erica. That was fantastic. Does anyone have any questions? And as we're waiting for that, does our panel have anything they want to add? Kaylee, I think you unmuted. I don't know if you wanted to say anything.
Well, one thing I was thinking about is that I think everybody knows that bottles and like baby bottle rot causes cavities in little kids. But there's a really high number of kids that get cavities from breastfeeding. And normally breastfeeding doesn't cause cavities, but the only times that I see cavities like from breastfeeding is when some moms will co-sleep with their babies and let them latch and stay latched all night. So it just kind of drips on those front teeth. And we end up having to take those kids to the operating room at like really young ages, like, putting them to sleep at 2 years old to try to fix their teeth and stop an infection. Um, so just remembering that, like, the reason why the bottle is so bad is that it allows the milk to just slowly drip there all night if they leave it in their mouth all night. And breastfeeding can have a similar effect when they breastfeed and leave like the nipple latched all night. And I just try to encourage the moms, like when I do see cavities and they say, no, we don't have a bottle, then I ask, well, do you breastfeed? And then do you co-sleep and like let them stay latched? And I encourage them to keep breastfeeding because it's great, but just break the latch before they fall back to sleep. And then we don't really see cavities from it. But I think that's a important thing that doesn't always get mentioned to parents. They're always surprised by that. And another thing I was thinking about when you talked about the studies, like when they were pregnant, about how it like decreasing like the strep mutans, that's the bacteria that causes cavities. They've done like a lot of studies too on xylitol on pregnant women. And so xylitol is a different type of sweetener, but it's in lots of gum. There's specific gums you can buy that are high in xylitol. And when moms are chewing xylitol gum during their pregnancy, they start by like at least 6 months into their pregnancy, and then they continue to chew it throughout after they have their baby. They have lots of studies showing that it decreases the chance of their kids getting cavities. And so if some moms say like, hey, you know what, I can't brush, like it just makes me throw up, or they have their different things, then one option you could say is, well, how do you feel about chewing gum? Does that bother you? And if it doesn't bother them, you could send them to get some like xylitol gum and chew that. And then like there's lots of different studies, but specifically one in 2010 said the kids that were in the group with the moms that chewed xylitol gum versus the control group, the xylitol kids, they acquired the bacteria that can give cavities almost 9 months later than the other kids, which is actually a really big difference because 9 months to a pediatric dentist, I mean, like the difference between doing a filling on a 3-year-old and a 4-year-old is a huge difference. And that could be the difference between them having to go under general anesthesia and not going under general anesthesia for treatment.